1 to 2% of the general population will have some issue with their elbow at some point in their life. Certain occupations or sporting activities increase this risk. Males in particular have an increased risk of injury as a result of a traumatic event. But for non-traumatic problems with the elbow, there's probably no difference between males and females in terms of their occurrence. Elbows can be injured by damaging either ligaments, which are ropes connecting bones to bones, through tendons that connect muscles to the bones, or by breaking the bones themselves. There are some injuries that are severe enough to damage a combination of all three of those structures. It's common for elbows to be affected by heavy sporting activities. Some sports are more prone to this than others. Throwing activities can often cause pain in the elbow. Racket sports have a reputation for causing things like tennis elbow, and kayaking or canoeing, which involve heavy repetitive activity of the elbow, can also cause problems. Most commonly, elbow problems arise through wear and tear, and this can be thought of as affecting either the tendons of the elbow or the cartilage of the elbow. Tennis elbow is perhaps the most common reason to have pain around the elbow, and it first manifests itself as pain on the outer aspect of the elbow. Pain can travel down towards the forearm or even into the wrist and hand. It's often exacerbated by lifting, such as lifting a heavy kettle, but it's unusual for movement to be restricted. Golfer's elbow is a similar problem that occurs on the inside of the elbow, but similarly travels down towards the wrist and hand. Sometimes wear and tear can affect the cartilage of the elbow joint, and cartilage is the smooth covering at the ends of the bones that allows the joint to glide smoothly. In wear and tear arthritis or osteoarthritis, this covering is gradually lost, and this often causes pain, swelling, and in many cases stiffness of the elbow. In some cases, loose bodies form inside the elbow joint, and these can float around, and intermittently with movement they can become jammed in the elbow, causing the elbow to seize up such that it won't move. In addition to traumatic injuries of the elbow or wear and tear injuries of the elbow, there are other conditions that can occur. The elbow can be affected by inflammatory types of arthritis, such as rheumatoid arthritis. This is often characterized by a lot of pain and swelling of the joint, and in many patients there are more than just one joint affected. Sometimes the elbow can be affected by arthritis processes that cause crystals to form in the joint fluid of the elbow, such as gout, and this causes a similar problem to rheumatoid arthritis. Some people experience marked swelling over the back of the elbow, the size of a golf ball or larger. This is often a boggy, fluid-filled swelling called olecranon bursitis. Sometimes nerves can become trapped or pinched around the elbow. Many of us will know about the funny bone sensation we get shooting down into our little finger if we bang the elbow awkwardly. And in some people, this nerve becomes trapped and squeezed over time, which causes change to the feeling in the little finger and the ring finger, causing it to go dead. This is often a problem if reading a newspaper or holding a telephone up to the ear. Most elbow problems can be managed by patients without resorting to visit a doctor or a specialist. But if there's been a significant traumatic injury to the elbow, particularly one that causes bruising or swelling or loss of movement, then it would be important to visit an A&E department for an X-ray to ensure that there's been no damage to the bones or that the elbow hasn't dislocated. Any problem that causes a lot of swelling, redness and pain around the elbow should also prompt seek medical attention, as in rare cases, infection can affect the inside of the elbow joint, and if not treated promptly and appropriately, this can cause arthritis to develop in the elbow over a very short period of time.